If you are struggling with symptoms of perimenopause or menopause, if you are struggling with stress, brain fog, or sleeping conditions, this episode, this video is for you. Hello, my name is Dr. Seyran Yüksel-Hatz. I am neuroradiologist and expert in stress medicine. Today I would like to introduce my colleague and friend Dr. Nurgul Fayyad Özdemir. She is consultant in obstetric and gynecology. Just get ready for the conversation.
First of all, menopause is a natural phase of a woman's life, and usually it's between ages 45 and 55. And here the patients can experience different symptoms. Every woman is different. For example, the symptoms are hot flashes, sweating, and brain fog, lack of memory, and of course, mainly they're starting earlier with the vaginal dryness, discomfort during intimacy, and then we start checking, screening for any abnormalities and find out what is the main reason. You're asking what kind of symptoms they're experiencing and to address the problem first. Yes. Menopause doesn't start suddenly. Of course, there is a transition phase. This is called perimenopause. And during the perimenopause, the woman experiences many symptoms. And every patient, every woman has different symptoms, different experiences. So, and then we will find out by first checking laboratory results, checking other health condition issues. For example, they can have thyroid issues, diabetes, or any other condition or autoimmune disease, which can lead also to similar symptoms. So first of all, we have to do a proper examination and ask the problems, to address first their problems clinically, and then we start checking in their blood to find out what kind of problem, reason, or the cause of the problem we are finding here. So this is the main important thing. So, and of course we are watching the patient's conditions and complaints to discuss and give support. There are many options of treatment. Options of treatment can be hormonal, non-hormonal, or just you start with lifestyle changes. And here I can say a lot. Lifestyle changes means, you do regular exercise with strength, and you watch your diet. What diet is important? Here I tell them go for a more high fiber diet. Check that you're having high calcium, vitamin D in your diet, and avoid stress. Stress is the main factor which can make more severe menopausal symptoms or more intense menopausal symptoms. And here I would like to know also from your side, what is the main reason they are stressed out? Can you tell me what is in their brain, what's going on in their brain? And this is for you.
Yeah, it's real. The symptoms in the brain is real. They feel, the main thing is they are tired, or they lack on concentration, a lot of memory loss. They go in a room, forget what they want, go back, like these symptoms. And what we can do is, how you say it, the lifestyle changes. The lifestyle is enormous important, because the body changes, the hormonal situation changes, and the first is for me, for my patients, to say, get better sleep. Sleep is very important for your brain, because during sleep your brain is like get a wash, because all the factors that are in your brain, because we knew that we take 20% our energy for your brain, and you have so much I think rubbish in your brain that should be washed out. And during sleep, and just during sleep, this goes out from your brain. You have no option.
I'm always recommending them, to have a good sleep.
Yes.
Because in that case, they should have a cool room, and they should not drink caffeine late hours or having heavy food late hours.
Absolutely.
So the sleep hygiene is also very important here. So we cannot just expect that medical treatment can resolve all the problems. Of course, the whole lifestyle should be changed. And also, I'm telling you, when we're aging, we need also minerals, supplements to support our well-being, our health, especially also sometimes I'm telling them probiotics, for example, are very important. The gut health is important. This is our second brain, we can say sometimes. Yes. So the food what we are eating, the minerals what we are taking are playing a huge role as well. And from your side, which minerals and supplements you would recommend, which helps with our brain to improve our concentration, to avoid brain fog, to get the best sleep? What is your recommendation?
First of all, I would say magnesium. There are some kind of magnesium. You have to check which one is the best for you. But magnesium is key in the sleep condition. And we need for be relaxed or for many reasons, although for the brain, we need magnesium. And the second you mentioned is vitamin D3, and in combination with K2. This is highly recommended because it is anti-inflammatory, and we need all this kind that the inflammation in our body, because if we came in the menopause or the perimenopause, the inflammations goes higher and higher, because estrogen is the hormone that is anti-inflammatory. So if we have reduced estrogen, so we need anti-inflammatory other kinds, so magnesium, maybe vitamin D3 or K2. There are the two main supplements that will I say is important for the brain.
So what is the benefit of bioidentical hormones, let me say, because we're offering the patients bioidentical hormones. These are hormones, they are plant-derived, and they're identical to our, they're chemical identical to our own endogen estrogen and progesterone, and here also testosterone. So if you balance these hormones in your bloodstream, you can get the best benefit out of it. And as we discussed before, it will help with our sleep, with our hot flashes. We start concentrating better, our muscles getting more relaxed, because I'm experiencing, my patients are also experiencing a lot of muscle cramps and stiffness in their bones and their muscles. So then they will feel improvement. So bioidentical hormones helps also with the vaginal dryness, discomfort. Here we are adding also moisturizer, lubrication, after we ruled all abnormalities. For example, if they have a skin condition or if they have any other diseases in the vulval area, any infection disease, we have to rule out before we are applying any treatment, estrogen. So alternatives are like some women, they cannot tolerate hormone treatment, or they have some cancer diseases like hormone dependent. For example, when they're a survivor of breast cancer and they have estrogen and the receptor progesterone, estrogen or progesterone receptor positive cancer, so they should not go for hormonal treatment. Only they're limited for vaginal estrogen. So these kind of patients, of course, they're adding to their diet supplements, they're doing regular exercise, they're doing meditation, yoga to improve their lifestyle. Acupuncture can improve. And of course, there are low dose antidepressants. I'm saying that at the end, because when I start telling my patients, antidepressants are also helping in hot flashes and sweating and for the general well-being. And that's why I'm telling this at the end. So there are also many more options of non-hormonal treatments, but the number one, the first line treatment is again here bioidentical hormones, which are transdermal and And here we are avoiding the first pass effect of the liver, so we don't have any coagulation issues like when we're taking it as an oral tablet.
And which woman cannot take hormonal treatment? You mentioned about the receptor, maybe cancer patients, but what other conditions, maybe migraine patient, can they take hormonal treatment?
Point. Of course, patients with migraines, they can also take bioidentical hormones, because here when we balance the hormones, they have less migraine attacks, and here we will avoid fluctuations in their hormone levels. So if we can balance it, the lowest dose, and to start early, and also to balance it continuously, they will experience less migraines.
Oh, very interesting.
We have to send the patient to the neurologist to find out what kind of migraines they have. So it depends. Yeah. So after the neurologist give us green lights, so we can start safely bioidentical hormonal treatment to avoid many attacks of migraines. I have mainly patients. Last time I had one patient. She was suffering. She's telling me, I cannot memorize. I'm struggling. I cannot find names. And I feel I'm totally brain fogged. What can I do?
Yeah.
And
okay.
What is your advice? What could it be? So mainly, of course, I have to tell them, when you're over 45 and having struggled to concentrate, and you cannot sleep, I'm asking if they also can sleep, or they have issues with the sleeping. Sometimes they're telling me also, I'm depressed, I'm not happy, I'm feeling lost, I'm feeling lonely, something is wrong with me, I never was like this, and I was a happy person. And then I'm telling them, okay, let's see, when we check your hormones, but in the hormones you will not see always abnormalities, because they're in the perimenopause. Maybe perimenopause can start from 45 or even earlier, in their 40s, late 40s, and sometimes in the mid 30s. So here I'm telling them it could be a sign of perimenopause, because sometimes you ovulate, sometimes you don't ovulate. You will feel the fluctuation. You will start feeling the lack of estrogen in your body. Not only estrogen, of course, also progesterone decreases, and testosterone at the end. Mainly at the beginning, it's not the estrogen, it's the progesterone. So in that case, they're starting having irregular periods, moody swings a lot, and here we start supplementing in the second phase of the cycle, because here mainly the progesterone drops. Why? Because they will not ovulate every month, and because of this anovulation, they don't form the corpus luteum. Corpus luteum is responsible for the progesterone production.
What is about the drop of progesterone means? What symptoms are from the drop?
Yeah, when the progesterone drops, you can have different symptoms. Like you start having irregular periods, you can have moody swings, you start being very emotional and crying a lot. Some they're starting having this PMS syndrome. It's called, this is mainly perimenstrual syndrome. Premenstrual syndrome. They're feeling the imbalance already. And because of lack of progesterone, they can start also having breast tenderness, pain in their breasts. So every patient is different. Not every patient has the same symptoms at the same time. So, and there is a lot of fluctuation, a lot of different varieties of symptoms.
Thank you. It's very important to know about all the symptoms, all the phases that the woman goes through. And for me, as stress expert, it's important to see all the patients with the symptoms, and the symptoms are real. It is not like unreal. They have problems. They have memory problems. They have problem about concentration. And because of dropping from estrogen, the main reason is the inflammation, and the brain fog results also because the patients have stress. It is an internal stress that's not visible. And if you feel stressed, you cannot be on concentration or good sleep. You have the address also to relax. to do stress management, to reduce your stress. What is the kind of you feel stressed out? Because for every woman, stress means something else.
Here I have a question for you as a neuroradiologist, Dr. Seyran. How they can cope with stress? What is happening in our brain during stress? Many women, they want to check in their urine. Can you please check my cortisol level in my urine? So what is the best timing for the investigation of cortisol? When we should do that, how we should do that, and how they can avoid stress, and what is happening in our brain, what we should do.
When we have stress, the stress activates our autonomic system. This is sympathetic system. The sympathetic system release very active hormones, like you say it, cortisol. And cortisol is a very powerful hormone that influences all of the part of our body, especially our brain. And the second hormone that comes if we have chronic stress is adrenaline. The combination of both have an impact of our brain. At the area first of all mentioned is hippocampus. Hippocampus is the area where our memory have. And the connection from the hippocampus to the frontal lobe, where we are creative, cognitive function, they are all related. So to reducing the stress or to measure the stress is enormously important. And you can measure cortisol, but it's a period where you are measuring. But if you have all the symptoms, it leads to the impact of your brain. And Dr. Mosconi have recently showed us in a research study where the brain circulation drops during perimenopause and menopause. And if you do not exercise or have not sleep, all this regulation, this is real that the circulation of the brain drops.
I have one question.
Yes.
Many women, we are recommending them do regular exercise. Exercising helps with the symptoms of menopause or perimenopause. So in this process, while they're exercising, what is happening exactly in our brain?
It is so important, Dr. Nurgul. Exercise, we women see it as weight loss, but it is much more than weight loss. If you do exercise for your brain health, you will see it another opinion to say it's not just weight loss, because it is for your blood circulation in your brain. You optimize it, you get better circulation in your brain. This leads, this exercise that you're doing, the exercise, just simple things, helps your brain to get in better flow. Blood flow increases. Yes, we have to see the exercise as mental health and protection of our brain. It is not just weight loss. It's not just have a better shape. The better shape is for your brain.
Are there more supplements and treatment options, non-hormonal, from your side? Which minerals we should increase in our diet?
All the B complex vitamins for the brain. All B vitamin complex is important, and you can improve your mental health about it. Yeah, but I think a good diet, a healthy Mediterranean diet is recommended, and to lower the sugar intake and all the sweet drinks what we have all around. We have to reduce, especially we women have to reduce, because the sugar the symptoms comes worse and worse about. And if we change our diet, it comes better, really. Mediterranean diet is recommended, it's highly recommended.
There are some research and studies that patients with insulin resistance or diabetes or obese patients, they're having more menopausal symptoms, more intense symptoms. Is there any treatment option from your side? Improvement, any recommendation?
For people that are in resistance, insulin resistance, it helps also the exercising, sleep, routine is crucial, because we know from the side, the neuroradiology, if you see the brain, they have structural changes also, because insulin resistance is also stress for your body, because there's so much glucose in your blood circulation that cannot be taken away. So there is inflammation all around. And we know from obese patients that the brains are structural different from healthy women.
Thank you to mention this inflammation, especially women when they're having problems, high cholesterol levels, obesity, and insulin resistance. They have the high risk of inflammation in their whole body, not only in their brain, also in your whole body there is inflammation, and the cardiac risk problem is higher. So yeah, there are so many factors we have to address and we have to discuss. That's why I'm always telling my patient, this is my routine. Regular exercise, get healthy food, and watch your diet. Make sure you're eating healthy fatty acids, and avoid processed food. So all what we are telling for pre-diabetic patients or diabetic patients to eat a low carb, low sugar diet, it's the same for the menopause, because the main condition like health diseases are starting to develop during perimenopause, menopause. For example, skin disease are more present. Pre-diabetic stage can go to manifest diabetes, and also your thyroid is starting to show abnormalities. So they should have the regular checkups by their doctor, either by the general practitioner, gynecologist, or endocrinologist, to rule out any abnormal condition in their health, to see where we can find the cause, why they have intense menopausal symptoms, and then we find the best solution treatment. So it's a general health checkup, we should do before we are going through treatment options. Yeah, we have to find first the cause and rule out any risk factors. We have to tell them prevent some diseases by following our advice.